So now we have Dr. Ron Swensen, who's in gynecological oncology at Valley Medical Center in Renton.
Thank you. What really got me interested in nutrition and cancer was the recent publication, actually in 2012, that showed that among endometrial cancer sufferers, the most common cause of death is not the cancer itself, but rather cardiovascular disease. So endometrial cancer is a metabolic disease for the type 1 types of endometrial cancers. Metabolic disease caused by the same etiology as type 2 diabetes and cardiovascular disease. And the great thing about this is if you fix one, you've fixed all of them. So it's a multifactorial benefit. How many of you guys have seen this particular series of slides? Well, I'll show it to you again. Not everyone has seen it, but it's quite remarkable how the obesity epidemic has washed over this country. And you'll notice that we in Washington State were a little bit late to the party, but we suffered nonetheless, particularly Dr. Park, it sounds like, with the 525-pound patient that you had to care for. But as we go farther along into this process, not only does obesity rise, but we also have the side effects of obesity, which is type 2 diabetes. And you'll notice that the slides look identical. It's simply a different label for the same disease process that's ongoing. I bring type 2 diabetes up because type 2 diabetes is a risk factor for various cancers. And if we treat the underlying pathophysiology, we get general health benefits across the board. And I would like to argue that the treatment, or that the correct diet, is, if it's not settled science, it's pretty darn close. If you go to the American Cancer Society, if you go to the UK Cancer Prevention Agency websites, if you go across cancer prevention rule or organizations that craft these guidelines, they all say the same thing. And what they are saying is that diet, exercise, smoking are the major drivers of cancer within the population, certainly the major preventable and modifiable drivers of cancer within the population. Of course, there are genetic risks that populations inherit. We're learning more and more about that, and cancer is at its core a genetic condition, a genetic disease. But the risk factors that drive the phenotype, the expression of that genome, is the dietary milieu that the body has going forward. And it's remarkable. These data are for the United States. In Europe, with a slightly less pronounced obesity epidemic, the numbers are perhaps 20%, 20% instead of maybe a third related to overweight and obesity. But regardless of that, the same basic underlying problem is present. So imagine if our cardiologists were able to wipe out, what'd you say, 775,000? And if we were able to wipe out 400,000, wow. And so it's admittable to say that we now have identified and we've attributed the cause. It would be perhaps a little overwhelmingly optimistic to assume that we could modify every single one. But even if we could make a dent in it, if the vegetarian population could go from 1% of the population to 10% or 20%, imagine the overall public health benefits to this. Ms. Gregerson talked about life in South King County, the deficits that are there for residents of South King County. Let me mention something. There's a place in South King County called DK Market that eradicates the food desert in that area. It's a huge warehouse full of vegetables, full of foods from all over the world imported into that area. It doesn't look like anything special, but it's a remarkable place to shop. I love it. Go there regularly. So the opportunity to utilize our food choices for our own health are there. Poor communities, wealthy communities, they're here. And in my mind, many of the best vegetarian options come from our immigrant neighbors and friends. For me, as I've adopted a vegetarian lifestyle over my lifetime, I'm always eating something derived from learning a little bit about Indian cooking. A white boy doesn't cook Indian food, but it tastes a lot like it, and it's delicious. So anyway. So let me just mention the types of evidence available to us in nutritional research. And this is, well, food choices are very personal. And people have a lot of emotion around food choices, a lot of emotion around where their food comes from. So even if we had perfect scientific data, there would still be a debate. But the problem is that the human population is extraordinarily difficult to get randomized, controlled, robust scientific data out with regards to nutritional studies. Why? Because it requires a lifetime of exposure. You can't do this for 3 months and suddenly measure a decrease in cancers or probably a major decrease in cardiovascular disease. You can certainly measure changes in cardiac lipids, a biomarker, but you can't see an endpoint of the actual disease in question. And these kind of challenges make the randomized controlled trial data virtually impossible to obtain. So we have to fall back on the cohort studies or case control hypothesis generating studies. You've heard people mentioning the EPIC Oxford study. You've heard people mentioning the Adventist Health study. That's because that's the relatively limited amount of data we all dip from, the same pond, for this evidence. So you'll hear me talking again about the Adventist Health study. So here we go. Dr. Gary Frazier, I had the privilege of learning from him. I was a graduate of Loma Linda University in 1988. Dr. Frazier began his practice a few years prior to that. And unlike his possibly experience of many of the rest of you, we had a preventive cardiology class in the freshman year. He brought us all in, walked us through the data, cooked us a meal, a vegetarian meal, tried to show us how to teach our patients how to live this. And I thought it was really pretty cool. And I'd like to show some of the data that I think you're going to want to know and why this is settled science. It's not really in much debate anymore. So you'll notice that so the Adventist Health Study basically is a Christian denomination where vegetarianism is encouraged, and about a quarter of the denomination actively practices this. About half of the denomination says they do but really doesn't, and then the last quarter of the denomination makes no effort to do so. So what is easy to do is to see how the vegetarians, the mostly vegetarian, and the standard dietary groups compare, which is exactly what Dr. Frazier did. So you'll notice that, and by the way, this is all from 20 to 30 years ago. So these BMIs, if we had these BMIs available to our populations today, we'd be golden. But we don't. So in any case, you'll notice that one of the other health behaviors Adventism expects of its adherents is to avoid cigarette smoking. So virtually all Adventists do not smoke. Most of them do not drink sizable amounts of alcohol, although some do. And so you'll notice the various risk factors within the Adventist population. And then the effect on of these risk factors on the population present. And what Dr. Frazier noted was that, forgive me, was that nut consumption also varied fairly significantly between the groups, and he observed that this was associated with a difference in health outcomes. Now, what are these outcomes? This is a provocative title on this article from the Archives of Internal Medicine published around 2001, where he asked the question, 10 years of life, is it a matter of choice? We've always assumed that when we die is known only to the fates or God, or as the case may be. What he argues here is that by the three major choices of a vegetarian diet, high nut consumption, and what was the third one? Physical activity. That with these sort of lifestyle choices, it was possible to experience progressively less mortality. You'll notice the age axis, and this little line is the difference between these two rates. So he started at the age of 30 because that wiped out all of the neonatal and childhood mortality, and began looking at adults. And then as the years went by, differences accrued, particularly on up until the patient's elderly years. And eventually, of course, we all reach the end of our lives. And you can see how these curves converge. But it was striking the amount of time available as a benefit to this particular lifestyle choice. And these are lifestyle choices. This isn't due to theology. This is due to lifestyle. And so individuals in this cohort were able to gain an additional 1.5 to 2.5 years through the sum of these three factors: high physical activity, frequent nut consumption, and vegetarian status, along with an appropriate body weight, resulted in an approximate 1.5 to 2.5 years gain in life for each of these factors. So it's impossible in the short run to see the payoff, but the payoff in this population, studied since 1980 to present, with the second cohort in practice right now, or in study right now, has observed these kind of dramatic benefits. So, of course, one could say, perhaps if you're living this long and not able to enjoy life, it just seems longer as well as being longer, and you therefore would not want to do that. But the reality of the fact is that the quality of life experience. Now, Dr. Fraser did not obtain a lot of quality of life studies. However, he tried to provide kind of a proxy for this by looking at some health consumption variables, and other studies have confirmed the benefits of this. This is a study published in the New England Journal of Medicine, where a similar index, this time including smoking, so this is smoking, body mass index, and physical activity, those three factors, for patients beginning at approximately age of 66. This was a college alumni study, looked at 66-year-olds, and then they started out by saying, okay, were you smoking? What was your body mass index? And then what was the physical disability experienced by that? The less of the sum was put in the lowest group, the moderate, and the highest group. These numbers obviously did not converge. The people who are at the lowest risk when they started out maintained being at the lowest risk on out until their mid-70s, whereas those who started out at highest risk grew forward. So it's not simply, or I should say, so these risk factors are associated with a far better quality of life than those who do not experience, who do not choose a lower risk lifestyle. Now, I'm just going to go over a couple of dietary items that I think are worth noting, because it's not complicated. A vegetarian diet, or a diet at least low in animal protein, think Mediterranean diet, which is essentially vegetarian diet light, right? That's going to provide the best fuel for the human animal. Nuts can be an excellent substitute for meat protein. It's high in protein, high in good quality fats, associated with antioxidant and anti-inflammatory properties. It has, unlike red meat, which has an increase in central obesity and an increase in insulin resistance, nut consumption is associated with a reduction in metabolic syndrome and central obesity, a key part of type 2 diabetes and the underlying physiology that leads to the pathology we see today. Despite the high caloric density, a study was done, again by Dr. Fraser, looking at what 300 calories worth of nuts daily did to overall body weight over 6 months of exposure. No change in the medium and highest weight tertiles. The lowest weight tertiles, that group gained a little bit of weight, but in medium to higher weight, which essentially everywhere. Probably in today's world, essentially the lowest tertile in his study would be our medium. But in any case, does not apparently increase weight, is an excellent substitute for meat in terms of protein on a health basis. And then finally, I just wanted to mention the Mediterranean diet. We are physicians. We're not fundamentalists. We don't believe that you have to do it, that only vegetarian diet is healthy. Certainly, for those who choose it, there's robust scientific evidence to support it. Individuals who choose to maintain animal protein as part of their diet can do so if vegetarian, and that's where the Mediterranean diet comes in. You want to maintain most of your calories come from plant-based foods as close to the way they are grown as possible. Once they go through a factory, they're damaged goods. So we want to have foods as grown, fruits, vegetables, whole grains, legumes, nuts. Limit butter, replace it with olive oil. Use herbs and spices instead of salt. Limiting red meat to, how would 0 be? But if you have to have something, once a month. Fish and poultry, a couple times a week. That sounds like basically a vegetarian diet with a little bit of animal protein. This is well supported and you'll notice this study, which was a study of in Europe of the Mediterranean diet. This is operated out of Padua, out of Spain, and again, the quintiles of adherence to this pro-vegetarian food pattern. The lower the amount of meat, the mortality rate declines. Same sort of study, different particular, same sort of outcome, different study. So I wanted to also mention briefly, and I'm almost done, so I don't want to take much extra time. Soy as a food source has gotten a bad rap. Please note why soy was considered to be dangerous. There was a model of MCF7 cells injected into nude mice. All of us that are medical students and other physicians know what this is. And then they fed these nude mice soy derivatives, and it turned out that the MCF7 breast cancer cell lines grew within nude mice. So this was thought to be evidence that soy is stimulatory toward breast cancer growth and development in vivo. Turns out that if you look at this meta-analysis of women who take plenty of soy, Shanghai women eat tofu and soy as a regular part of their diet. And these 3 large observational studies followed over a period of 7.5 years, there actually was a modest decrease in breast cancer recurrence rates, even more so in those who are already on tamoxifen, more so in those who are ER negative of all unexpected ones, and similarly in the postmenopausal cohort. So what I would say to this is I wouldn't prescribe soy for anything other than its dietary benefits, but rather than having patients fearful of that whole food, of that whole category of vegetarian foods, I think the evidence in women, not in animals, shows that it's safe to go forward. To just summarize, and this came from Dr. Jacobs and his authors, eat foods, mostly plants, not too much. In other words, keep your calories under control. In colorful variety, maximize nutrients per bite. This means leave the processed stuff in the grocery store. Don't eat that stuff. Eat real food, and it will maximize your health. Thank you very much.